Lung diseases can be debilitating and life-altering conditions that can affect millions of people worldwide. They can range from chronic obstructive pulmonary disease and asthma to pulmonary fibrosis and lung cancer and more. While many lung diseases cannot be entirely cured, there are several strategies and lifestyle changes that can help manage symptoms and improve lung health. In this video, we'll explore various approaches to better manage and potentially improve lung diseases. But before we get started, make sure you're subscribed to our channel for more exciting contents. Number 1. Understanding lung disease. To effectively manage and improve lung health, it's crucial to understand the specific lung disease you're dealing with. Common lung diseases encompasses a wide range of conditions, each with its unique characteristics and challenges. Here, we will delve deeper into these conditions to provide you with a more comprehensive understanding. First is chronic obstructive pulmonary disease or COPD. COPD is an umbrella term that includes two main conditions, emphysema and chronic bronchitis. This group of diseases is characterized by the restriction of airflow in and out of the lungs, often due to the following factors. Emphysema primarily involves damage to the air sacs in the lungs, reducing their elasticity. This leads to the collapse of these sacs, making it challenging to expel air. Over time, it results in the trapping of air in the lungs, causing shortness of breath and a feeling of constant fatigue. Next is chronic bronchitis. Chronic bronchitis, on the other hand, is characterized by the persistent inflammation and irritation of the bronchial tubes. This leads to excessive mucus production, which can block the airways and make breathing difficult. Chronic bronchitis often causes a chronic cough, excessive mucus production, and recurring respiratory infections. Understanding the specific subtype of COPD you have is crucial for tailoring your treatment and management strategies effectively. Next is asthma. Asthma is a chronic respiratory condition that involves the inflammation and narrowing of the airways. While it's not necessarily always considered a lung disease in the traditional sense, it significantly impacts lung function. Asthma is characterized by the following: airway inflammation. In individuals with asthma, the airways become hypersensitive and prone to inflammation. This leads to swelling and the production of excess mucus. Airway constriction. When exposed to triggers such as allergens, smoke, or exercise, individuals with asthma experience airway constriction, resulting symptoms like wheezing, shortness of breath, and coughing. Asthma is often managed with medication to reduce inflammation and bronchodilators to alleviate airway constriction. By understanding your asthma triggers and symptoms, you can effectively manage and prevent exacerbations. Next is interstitial lung disease or ILD. ILD represents a diverse group of lung disorders that affect the interstitium, which is the tissue surrounding the air sacs. This damage to the interstitium results in difficulties in breathing. Some key points regarding ILD include various causes. ILD can have various causes, including exposure to environmental toxins, autoimmune disorders, and unknown factors. Its diverse etiology makes diagnosing and managing ILD a complex challenge. Progressive scarring. One common feature of ILD is progressive scarring of the lung tissue, which affects its ability to expand and contract. This leads to a reduction in lung function and makes breathing increasingly difficult over time. Symptoms vary. The symptoms of ILD can vary widely but often include shortness of breath, a persistent dry cough, and reduced exercise tolerance. Diagnosing the specific subtype of ILD is essential for tailoring treatment. Next is lung cancer. Lung cancer is a life-threatening condition characterized by uncontrolled growth of abnormal cells in the lungs. The development of lung cancer is often attributed to several factors. First, smoking. Smoking is a major risk factor of lung cancer, with cigarette smoke containing carcinogens that can damage lung tissue and lead to cancerous growth. Second, environmental factors. Exposure to environmental carcinogens such as asbestos, radon gas, and industrial pollutants can also contribute to the development of lung cancer. And lastly, genetic predisposition. In some cases, a genetic predisposition may play a role in the development of lung cancer. Lung cancer often presents with symptoms like persistent cough, chest pain, coughing up blood, unexplained weight loss, and difficulty breathing. Early diagnosis and intervention are critical in improving outcomes for individuals with lung cancer. Next disease is pulmonary fibrosis. Pulmonary fibrosis is characterized by the scarring and thickening of lung tissue. This condition results in reduced lung function and makes breathing increasingly challenging. Key aspects of pulmonary fibrosis include unknown cause. In many cases, the exact cause of pulmonary fibrosis remains unknown, which can make it challenging to prevent or treat. Progressive nature. Pulmonary fibrosis tends to progress over time, leading to a decline in lung function and a decrease in body's oxygen levels. Symptoms: Common symptoms of pulmonary fibrosis include persistent dry cough, shortness of breath, fatigue, and discomfort. The severity of these symptoms can vary from person to person. Understanding the specific lung disease you're dealing with is the first step towards effective management and potential improvement of your lung health. Each condition has its own unique characteristics, causes, and symptoms which will inform your treatment plan and lifestyle adjustments. It's important to work closely with healthcare professionals to address your specific needs and develop a personalized approach to managing your lung health. Number 2. Consult a healthcare professional. If you suspect or have been diagnosed with lung disease, it's crucial to consult a healthcare professional, preferably a pulmonologist or respiratory therapist. They can provide you with an accurate diagnosis, treatment options, and a personalized plan for managing your condition. This may include medication, oxygen therapy, pulmonary rehabilitation, or other interventions. Number 3. Medications and treatment. Depending on the type and severity of the lung disease, your healthcare provider may prescribe medications to manage symptoms and slow disease progression. Some common medications for lung disease include bronchodilators. These medications relax the airway muscles, making it easier to breathe. Next is corticosteroids. These reduce inflammation in the airways, helpful for conditions like asthma and COPD. Next is antibiotics. They are used to treat lung infections, which can exacerbate lung diseases. And lastly, immunosuppressants. These drugs may be prescribed for autoimmune-related lung disease such as ILD. It's essential to follow your doctor's instruction and take medication as prescribed to manage your condition effectively. Number 4. Lifestyle changes for lung health. Beyond medical treatments, making certain lifestyle changes can significantly impact lung health. If you smoke, quitting is the most important step you can take to improve your lung health. Smoking is the leading cause of preventable lung diseases, including lung cancer and COPD. Even if you're not a smoker, exposure to secondhand smoke can harm your lungs. Make sure your environment is smoke-free. Reduce exposure to environmental pollutants and toxins. For example, avoid areas with heavy air pollution and use air purifiers in your home if necessary. Lastly, regular physical activity can improve lung function, increase stamina, and enhance overall health. Consult your healthcare provider for exercise recommendations tailored to your condition. A diet rich in fruits, vegetables, lean proteins, and whole grains can help maintain a healthy weight and provide essential nutrients for lung health. Proper hydration keeps the airways moist, which is important for lung function. Breathing exercises such as pursed lip breathing and diaphragmatic breathing can help improve lung capacity and oxygenate your body more effectively. Number 5. Pulmonary Rehabilitation. Pulmonary rehabilitation programs are designed to help individuals with chronic lung diseases. These programs typically include supervised exercise, education on managing your condition, and psychological support. Participating in pulmonary rehabilitation can lead to improved lung function and better quality of life. Number 6. Oxygen therapy. For individuals with advanced lung diseases, oxygen therapy may be necessary. This involves using oxygen equipment to help maintain adequate blood oxygen levels. Oxygen therapy can enhance your ability to engage in physical activities and reduce shortness of breath. Number 7. Vaccinations. To protect your lung health, make sure you're up to date on vaccinations. The flu vaccine and pneumonia vaccine can help prevent respiratory infections that can be particularly harmful for individuals with lung diseases. Number 8. Avoiding respiratory infections. Preventing respiratory infections is critical for individuals with lung diseases. Practicing good hygiene such as frequent hand washing, avoiding close contact with sick individuals, and wearing a mask during flu season can help reduce the risk of infections. Number 9. Monitor your symptoms. Keep a diary of your symptoms and any changes in your condition. This can help you and your healthcare provider track your progress and adjust your treatment plan as needed. And lastly, number 10. Surgical interventions. In some cases, surgical procedures may be recommended to treat or manage lung diseases. These interventions can include lung volume reduction surgery or LVRS, lung transplant, or minimally invasive procedures to remove damaged lung tissue. While many lung diseases cannot be entirely cured, there are numerous strategies and interventions that can help manage symptoms and improve lung health. Understanding your specific condition, consulting with healthcare professionals, and making lifestyle changes are key steps in this journey. By following your treatment plan, making healthier choices, and seeking emotional support, you can enhance your quality of life and better manage your lung disease. Always consult with your healthcare provider for personalized advice and guidance tailored to your specific condition. Remember, managing lung diseases is an ongoing process, and with the right approach, you can lead a fulfilling life. And that's it! Thank you for watching this video. Also, don't forget to like and subscribe to our channel.